The Big Show on Kiss 92. Gotta get up.
Good morning, Singapore. Reunited, and it feels so good. Welcome to Good Morning, Doctor. And the reason why I just sang that song is because we've spoken to Dr. Cheryl Lau before. She is a general and colorectal surgeon from Parkway East Hospital. We did Good Morning, Doctor when we were on 1FM 91.3, and she's back with us on Kiss 92.
Thank you so much for having me. Thank you.
So good to see you.
Yes.
You look very well.
Oh, so do you all. You look younger year by year.
Wow, that's a good way to start the day.
You can come in every Wednesday then.
So today we're going to be talking about anorectal disorders. So what are anorectal disorders and how common are they?
Well, anorectal disorders run the spectrum from bleeding issues from a bottom or anus, anal lumps, anal pain, anal itch. So any of the symptoms that we experience at the bottom, that belongs to the anorectal disorders. I would say that probably 50% of us will experience one of these symptoms in our lifetime. And it's postulated that the true prevalence is not known because a lot of us are embarrassed to seek medical attention for this.
Yeah.
Yes.
Well, what causes these problems, though?
Okay, so it depends on the symptoms that we experience. For example, if you're talking about bleeding issues, if we bleed from the bottom, by and large, most of the time, I would say it's hemorrhoids or pulse bleeding. Yeah. So if you see blood on the toilet paper, number one, don't be frightened. Don't be alarmed.
Yeah.
See a doctor. We will assess. So if, for example, for bleeding, let's talk about bleeding. If there's only blood stain on toilet paper and there's some pain at the bottom, it could be a tear at the anus or what we call anal fissure, bottom fissure. If it's painless bleeding, that means when we poop, we see blood on the toilet paper together with the poop, that sounds like pulse bleeding.
Right.
Oh,
Yes.
so painless.
And
Okay.
hemorrhoids can be external or internal.
Exactly.
Right,
Exactly.
okay.
Or if, for example, if there's blood without stools, now that is alarming symptoms.
Blood without stool.
That's right.
Oh.
So we sit on the toilet bowl, we try to do a defecation, and
it
you just
says
see
blood.
blood. That's
Oh,
right.
no.
That's not right.
Okay.
That one you have to seek medical attention quickly. If there's maroon colored blood, so it means blood mixed together with stools.
All right.
Okay, that's something going on in the colon. So that's
colonoscopy maybe?
That's right. Yes.
Okay.
Yeah. So that's not just the bleeding type that we experience, but the age group of the patients that we see. The younger population, 90% I would say is hemorrhoids. If it's the older population, probably 40 years old and above, the threshold to perform a thorough investigation like a sigmoidoscopy or a check of the bottom part of the colon or colonoscopy will be lower.
Okay.
Yes.
Okay.
Wow.
Wow, I tell you, there was one time,
Yes.
years ago,
Yes.
I remember I was so constipated, right? So I was on the toilet bowl, right? And I was just straining, which is
Oh,
really, really
bad.
bad.
Oh, that's
It's
very
so
bad.
bad to strain.
Yes.
And then eventually, I mean, when some came out, obviously there was blood on the toilet paper.
paper.
Yes.
I panicked, boy, because it never happened to me before.
Yeah.
Yes.
You know?
So if you talk about pulse bleeding, that's the very common topic that patients will always ask us about. Pulse, what are the predisposing factors? But believe it or not, it is sitting on the toilet bowl for too long.
Right.
Yes.
So don't doom scroll on your
So-
toilet.
Exactly.
So some people, I think, is it a family thing? Is it a genetic thing, or if it's in the
if
family?
you sit on the toilet for a long time, it's your own thing.
No,
what?
but some people just have piles,
Yes.
Oh, is it hereditary?
No. We do not know for sure.
Oh.
We do not know for sure. That's number one. Nobody do a true scientific study on this.
Yeah.
But anecdotally, yes, it's possible. When
Okay.
we speak to patients, they say, oh, my dad has this,
Yeah.
my grandpa has this. It is possible. But I think there's an indirect link because of the habit, the defecating
Right,
habits.
yeah.
Right.
Toilet habits.
Because I
Toilet
remember
habits,
when I was
yes,
growing up, I
yes.
remember my dad was always telling me, after you do your business, always make sure you go and wash your backside.
For sure.
Yeah.
Yeah.
That's
You
a
know
good
what I mean?
habit to have.
Yes.
A lot of people use
Yes.
just loo paper nowadays.
Oh, that's
yeah.
not good. Yes.
That's not good. Yeah.
Yes, yeah.
So
Okay.
so there is some truth in that.
Yes.
When we go on the Big Show TV, I have a burning question about the position.
Burning?
Well, sorry. I didn't mean to do that. I did not mean to do that. It was very unintentional. A question about the way you sit on a toilet. Because I've been seeing a lot of stuff on social media, but I can find
Yes.
that out on the Big Show TV.
All right. Okay.
Okay.
Meantime, here's Martin Garrix, who will be at an NYE party
in Bali, Yes,
this
at
year.
Atlas, yeah. You can't miss it because both
The
of us went to
poster.
Bali over the weekend.
was
We
so
saw
huge.
the poster.
Yeah.
So yeah,
He loves Bali.
Atlas is the largest beach club in the world. I think they hold something like 20,000
Amazing.
people. It's crazy.
it's
Anyway, here he is with Real Love on Kiss 92.
He's like the poster you can't miss, right?
Yeah,
Everyone
man.
coming out the airport is like,
Hey,
oh,
Martin
Martin
Garrix.
Garrix is going to be here.
Bali.
Okay, so Dr. Lau,
Yes.
you scroll on Instagram and stuff like that. I mean, nowadays we're privileged, or I don't know if it's a blessing or not, to have seated toilets. But back in the day, they were all holes in the ground.
Absolutely. Yes.
Squatting toilets.
Yes.
But you see a lot on social media how people should actually be squatting because of the position of your legs, as in your knees bent, rather than sitting on the toilet. What is your take on that?
Well, there is a scientific basis to this.
Okay.
So when we are seated on a toilet bowl, that's not really a natural way to do a defecation.
Oh.
Why is that so? Because your buttock is supported by the ring of the toilet bowl. But
Yes.
if you are not seated forward, you are leaning backwards. The anorectal angle is a bit kink. And you need more force to push the stools through.
Oh.
So for patients with what we call obstructive defecation, means they have the difficulty.
Constipated.
That's right. They're constipated. They can't really push the stools out. I would advise them to get a defecating stool. So what that means is
Squatty potty.
that's right. Yes.
Yeah,
so
I
they
love.
put it at the base of the toilet bowl. They rest their feet on,
On the
that
seat,
That's
right, yeah.
on the stool.
On the stool, yeah.
So that the knee is above the hip.
Oh,
And then lean
right.
forward a little bit. So when they lean forward a little bit, but the buttock is still supported by the toilet bowl, it kind of open up the anorectal angle. Yes. And it allows for the descent of stools easier.
Got it. So
Yeah.
it's not all just social media
That's right.
rubbish.
No, it's
There
not.
is science
There is a
behind it.
scientific- yes.
Yeah.
Okay.
But this is especially for people who find it difficult.
Yes.
Should
doing
it be
their
an
business.
should it be an everyday thing though? I mean, is that a
I-
better position than the seat, the
I-
regular toilet?
For us guys, we have no problems. What?
It's the same thing.
No,
though.
normally.
Anyway.
No, you know why?
No
Because
problem.
you have long legs.
Long
For
legs.
myself,
Are your knees
Have
above
Any
your
angle, we
No,
can
no,
stand
no.
up and do it also
Oh,
if
God.
we want.
Oh my
Yeah.
goodness.
No, but what
No, I'm
she's
just
saying,
saying.
what she's saying
Right,
is
every-
your
high five,
knees.
The knees above the
Your
hip.
knees need to be above your hips. Are your
Yes.
knees above your hips? Unless you're holding on to your
Anything.
knees.
I can
No.
do it upside down
God, we
also.
don't want
no
to-
Guys
Maybe
have
it's-
it easier.
Yes,
Guys have
there
it
you
easier.
go.
Okay, so why?
Yeah.
Why is that?
Because ladies, we have our uterus.
And we have a longer.
That's right, the longer sigmoid colon.
colon as well, right?
And we have the female hormones coming to play.
Right.
The intestines time kind of slower. The transit time is slower compared to guys. So there is truth to the fact that guys have it easier in the toilet. So it's almost
I
like a
still-
straight pipe for them.
yeah, I
Okay.
still
They're
don't
the
buy
ones
that
suffering.
Glenn can
Yeah.
poop standing up though.
Upside down so I
Upside
can.
down.
Hey, ew.
Okay.
Can someone install Ariel's silks in Glenn's bathroom?
You know, when I was
so
in the
that-
army, when we were in the
Yeah.
jungle
In the
and all
bush?
that. Oh my goodness. I mean, there's no time. In like 5 seconds, you better go and just
This is
squat
what NS
somewhere
is
or
good
whatever.
for, poop training.
Yeah,
Oh,
but that's a
God.
good topic.
Yeah,
That's a good topic.
and sometimes I don't want to squat completely because in the
Yes.
jungle you don't know what is going to crawl up, right?
Exactly.
So it's like half squat.
I have a question from Eddie on Facebook. He's asking, is hemorrhoid dangerous if it's left untreated? And
Okay,
I
that's a
guess
very good question.
Yeah. Also,
Yes.
maybe how can we identify what it is?
Yes.
For those who don't know.
Yeah, what are hemorrhoids?
Oh.
Maybe that we can start with
Well,
that.
hemorrhoids are vascular cushion or vessel cushion in the anal canal. All of us will have vascular cushion in the anal canal. That's normal. It's a normal anatomy. But hemorrhoids happens when the vessels swell up, become dilated, and the connective tissues around the area becomes loose and they start to pop out. So hemorrhoids, there are many grades. If they are internal, means they are inside the anal canal, we will experience bleeding on off. It might be painless bleeding. Those kind of hemorrhoids, we can treat conservatively. So we give medications to shrink the vessels. We put in a suppository. We do lifestyle changes because prevention is better than cure.
Yep.
Yeah.
Right? Yeah.
So you can't
pooping
remove
habit-
the internal
Oh yes, we
hemorrhoids?
can.
You can,
we can.
right.
Definitely, we can. We can treat them. We can treat them. So short of removal, short of surgery, we can do, for example, laser therapy. We can do band ligation.
Yeah.
Yeah.
Are there any risks with these procedures?
Oh,
because
definitely.
there will always be, right?
That's
Okay.
right, yes. So let's start from the simpler procedures to the more invasive procedures. If the hemorrhoids are internal, we don't see them on the outside. For example, we can do band ligation. So banding entails putting a rubber band along the pedicle or the apex of the hemorrhoid cushion where the blood vessel comes out from. So we tie up the hemorrhoids, and over 5 to 14 days, the vessels shrink up.
And it falls off.
Yeah, that's right, yes. But that is relatively painless. Why? Because it is applied at the area where there's minimal nerves ending.
Okay, got it.
It's mainly to treat the blood vessel bleeding.
Almost like an umbilical cord falling off.
Exactly.
Okay,
Exactly.
yeah.
That's a good analogy.
Okay.
Yeah.
Yes,
Some people
yes.
have chronic hemorrhoids, right?
Oh, definitely. Yes.
Pregnant
Hemorrhoids-
women, I tell you, pregnant women. Yeah.
Exactly.
Yeah.
Pregnancy predisposed to hemorrhoids. Why? Because the pelvic vessels will swell up, the abdominal pressures increase with the size of the baby, and all this all transmit down to the anal veins, and the anal veins will swell up time. And it doesn't help that pregnant ladies are prone to constipation.
Yeah.
So I guess internal hemorrhoids is worse then.
Well, internal hemorrhoids, number one, because there's no nerves endings within the anal canal, there's minimal pain. The external hemorrhoids, those are painful. If the hemorrhoids are very swollen, they popped out, or the anal skins are stretched out, ulcerated, those cause a lot of pain. And that's when most patients will come and seek medical attention.
Right.
Yeah.
Okay, we're going to go back on it.
When we go back on air, I want to talk about something you mentioned: lifestyle changes.
Absolutely.
Okay, it's all yours, FD, when we come back on air. Stand by.
Pilot on.
Yes.
Wow. Was that you, Angel?
Yes.
That was good.
What was that?
Pilot on.
Oh.
FD.
It's a pun. So punny.
Kiss 92 traffic.
On the KPE towards the TPE, right at the Bartley Road East exit, look out for a broken down vehicle. If you spot anything else, it's 8855-0920. Stay safe.
Good morning and welcome back to The Big Show and The Big Show TV. It's Good Morning Doctor. And we say good morning to Dr Cheryl Lau, General and Colorectal Surgeon from Parkway East Hospital.
Good morning.
Good morning.
Good morning.
Doctor, we were talking about hemorrhoids, and one of the things you mentioned were lifestyle changes.
Yes.
What are the changes?
Prevention is better than cure.
Yeah.
Yes. So anything that increases the pressure in the anal canal vessels will increase the risk of hemorrhoids. So it's the effort of straining. If we sit on a toilet bowl and we push and nothing is coming out, a lot of thunder and lightning but no rain, just get out. Yes,
Right.
sit out, get off the pot.
Okay.
Yeah. So on average, I would say a complete bowel movement will usually take about 10 seconds to 30 seconds. Beyond 30 seconds, you sit there and do a sustained pushing.
Oh.
If nothing is coming out, you just get your mind off it. Say, okay, probably I need to just do something else. Stand up from the toilet bowl,
Walk around.
drink warm water,
Yeah.
walk around until you get the next urge, and then you try again.
Some people stay in the toilet for like 30 minutes, and you're saying 30
that's right.
seconds?
Oh, that's not good. Yes. 30 minutes. Okay.
Wow.
Yes. So we had asked ourselves, if I do that for 30 minutes, what is making me do that? Is it because I'm bringing my smartphone with me
Yes.
into the toilet?
Yeah.
Yeah.
And
Sometimes
Yes.
my iPad,
That's right.
And
Because
that's
it's
not
your
good.
me time in the toilet.
But that's
Yes.
no good.
It's not good.
That's
Absolutely
no
not.
good.
Yes.
Okay.
So that's number one.
I'm not borrowing Daphne's.
Yeah, ew, gross. I'm not even touching FD's phone. Ew.
Sorry, doctor. Sorry. So sorry. Go ahead.
everyone
go ahead.
does it.
Please go ahead.
Yes.
What about
thing
the
is increase
She
fiber.
hasn't finished.
We increase fiber. Increase fiber in the diet. Fiber. That's number two. But of course, it's not a one blanket rule for all. If, for example, elderly patients with slow transit constipation, means the nerves and the intestines are kind of slowed down. If I bulk up that patients with a lot of insoluble fiber, we're going to get a lot of stagnant stools within the colon, and they're going to feel very hard to poop.
Yeah, I was going to ask
Yes.
about the
Yeah.
insoluble fiber, because
Yes.
people just take fiber thinking all vegetables are
yeah.
great.
Exactly,
But things
yes.
like kale are
Yes.
insoluble fiber. So
Yes.
how would people know
Ah.
which fiber is good?
First, seek medical doctor advice. We will ask a whole series of questions on how your constipation's symptoms are, because constipation can range from slow transit, means the intestines are moving very slowly, and we find out whether there's any correctable causes. Is it a hormonal issue? Is it a thyroid hormone issue? Is it an electrolyte imbalance? And the second reason for slow transit is, for example, if the patient is sedentary. If you sit down the whole day, working from home, and we don't really move around, everything slows down. including your intestine. So going for walks in the evening, there is a basis for that. It helps to keep your gut healthy, it moves things along. The third thing is obstructive defecation. What that means is if there are things stuck within the colon, making you uncomfortable and you're unable to do a bowel movement, that warrants a colonoscopy.
What could be stuck?
For example, a polyp or a small growth,
Okay.
or the worst case scenario is a bad growth within the colon that's blocking up. People always think that growth equals to bleeding, but the growth might or might not bleed. So if there's any change in the stool caliber or any change in the bowel habits that last for more than 2 to 3 weeks, always seek medical help.
Okay.
Yes.
So I go to the hospital
Yes.
once a year for bowel obstruction because I had an old surgery that left scar tissue
Yes.
that sometimes it tangles with my small intestines.
Oh, that
so
hurts,
then,
lovely.
yeah, it's like the
Yes.
worst pain I've ever been in, and I have
Yes.
high tolerance pain. And they said there's nothing they can do. So it's just one of those things where when I feel the pain, then I go to the hospital. But that's an example, I guess,
Yes.
of like it's not a growth, but
It's not piles.
It's not
Yes.
piles, and yet it's something that does obstruct.
Yes.
But
It's
Dr. Lau
basically
can fix
scar
you.
tissue. Yes.
No, no,
Right,
cannot.
Dr. Lau.
Yes.
Is there
Cannot
any way to
tissue.
fix her?
Cannot, right? Because they open up, you
can.
create more scar tissue. That's
Well, not necessarily. Sometimes we can do an elective keyhole procedure to snip off the scar tissues.
Oh.
Yes. So when the intestines are not swollen up, because when you go to the hospital, that's
It's
usually when
already
your intestines is swollen.
Yeah.
Yes. So when they are swollen up, there's no space in your tummy. You just feel like a balloon.
Yeah.
What the doctors would do is they keep you.
They
New by
just-
mouth. That's right. They keep you, completely. You don't eat anything. They
Yeah.
put you on a drip.
Empty you out,
Yes, they empty you
basically.
out. That's right.
Yeah.
Until you decompress.
and I've had to do the tube before, which was the worst.
Very uncomfortable.
Yeah, it's super
Yes.
bad. It
So
goes
there
up your
is-
nose and down your esophagus to
Yes.
suck out all the bile and.
So
and
there is
stuff
a
that's
solution, though.
There is a solution.
Oh, there you
yes,
go.
Yes.
Yeah, I'll
Yes.
try. I mean, yeah, I'll look it up because there was a surgeon that suggested that I just cut my small intestines, and shorten
Stitch it
it
back
so that it
together.
won't wrap around the scar tissue. But that surgery was like 50 grand or something.
She
and I
look
was
at
like,
her, look at her
Wow,
face,
wow,
though.
wow.
Look at her face.
Okay. Just go and
let's
see
go back, yeah.
Dr. Lau, okay? Just go and see
Thanks,
Dr. Lau.
Dr. Lau.
She
Not-
sounds like she knows what she's talking about.
Not all doctors are the same.
No.
But,
Yes.
but I did want to go back to Eddie's question. So
Yes.
hemorrhoids, is it dangerous if it's untreated?
Okay. If they are early, number one, not all hemorrhoids require surgery.
Okay.
That's the take-home message. It's not like Mount Everest, we see it, we must climb it. No, yes. It depends on the symptoms. I think what Eddie is worried about is whether hemorrhoids lead to cancer. No, hemorrhoids do not lead to
No,
cancer.
okay.
No,
Oh,
they do
that's
not,
really
yes.
good to know.
But the symptoms of hemorrhoids may mimic symptoms of cancer and vice versa.
Like
Vice
what are the
versa.
symptoms?
So bleeding doesn't mean that we see hemorrhoids. Hemorrhoids are the cause of bleeding because a lot of people have hemorrhoids, but not all hemorrhoids causes bleeding. So if usually hemorrhoids bleed, they will last for maybe 1 to 2 days, and they kind of settle by themselves once we change our lifestyles or we have a good bowel movement. There's no more straining effort. But if the bleeding persists, that means there's something going on in the colon. Okay, so hemorrhoids, if we do not remove them, what do they cause? Do they cause infection? Do they cause a lot of pain? Now, these are what Eddie is, I think, referring to is external hemorrhoids. That means hemorrhoids on the outside that we feel. If we remove hemorrhoids, there are usually 3 symptoms that we do the surgery for. Number 1, if the hemorrhoids are thrombosed, very swollen, prolapse out, and causes a lot of discomfort, a lot of ulcers. If they are obstructing the entrance of a bum and we cannot really poop, yes, that warrants a surgery. Number 2, if the hemorrhoids keep bleeding non-stop, despite conservative measures, even though we give a lot of medications, we apply a lot of ointment, we put suppository, and they just keep bleeding because the vessels are swollen to the point of no return, then it's best to remove the hemorrhoids. Right? Yes. And number 3, well, that's the lesser thing that we tell patients, but that is mainly something that they are worried about is cleanliness. Sometimes we see hemorrhoids that are like cauliflowers, they kind of open up and the crevices in between the hemorrhoids are where it collects stools and a lot of bacteria, and they feel so uncomfortable all the time, or it gets very weepy and sipping.
Right.
So it's best that we remove those hemorrhoids.
Wow.
Okay, let's continue to talk to
Yes.
Dr. Lau on The Big Show TV.
Yes.
All right, it's 8:20.
Kiss 92 Time Check brought to you by Putian. Savor our decadent.
There you go. For
That-
people who have not seen the hemorrhoids before, it looks like a cauliflower.
Cauliflower-like. I
Yeah,
mean, that
it's terrible.
description alone is like, oh, is that what hemorrhoids internally look like as well? Because obviously we can't see them.
Well, hemorrhoids internally, they will just look at like a big blush, like a flower. Yes.
What kind of flower? There are many different flowers.
Bluish, reddish, yes.
Oh, right,
Wow.
okay.
Yes.
Wow.
Yeah.
Daphne
That's
is
why they
in
can
shock.
be-
Yeah. The other question that's come up on our Facebook is the type of food we eat. Does that exacerbate hemorrhoids?
Yes. This is the same question that most patients will ask me. I noticed that, so the question that patient will ask is, I noticed that they take a lot of spicy food, chili curry, and it kind of makes the hemorrhoids more painful. I would say the layman evidence for that is pepper or spicy food, they tend to pass through the gut semi-undigested.
Mala.
Mala, exactly. You know, if they
Make
don't
spicy.
mala hot,
Dun.
that's right. The next day you get a bit of diarrhea. Yeah.
This is the Mala King.
Yes,
Yeah.
mala king.
Love mala.
So you imagine that spiciness is irritating the bottom as it comes out.
But
it kind
is
of
it the
flares up
same for
hemorrhoids.
everyone though? Is it the same for everyone?
Oh, no, not
So
necessarily.
some people can process it and some people can't.
Yeah, but I
That's
tell you
right.
what,
We're not all built the same.
the number of
Yeah.
people who are listening to us right now who have like problems, piles, and stuff like that.
lot.
They're thinking to themselves now, oh no, I think I've been eating a lot of mala. So if that's the
spicy
case,
food,
then
yeah.
then stay off the mala for a while and see
And
whether
see
your
if it
condition
helps.
improves, right?
That's
Yeah.
right. And indirectly, spicy food makes it worse because when we take a lot of spicy food, we have diarrhea. So multiple bouts of explosive diarrhea will make the bottom swell up.
Yeah.
And your hemorrhoids
Right.
kind of pops up. Yes.
Agitated.
So
Agitated, that's right.
Prashant, stay off the mala, Prashant.
Prashant, what's up?
Everything in moderation.
You're a guy, Prashant. How come you're having this sort of problem?
It's not just women.
Hey, it's not just
Because I
women.
hear a lot of women talking about this. It's like the
Yeah.
moment they have like spicy food or whatever, they get uncomfortable
No,
I mean-
that's
and,
right.
and stuff, and that leads to other things.
Exactly.
Why does spicy food lead to bloating as well? Is that
I would say it's more of a stomach issue
Okay.
rather than a colon, because when we take a lot of spicy food, the gastric acidity goes up, and when your stomach gets very acidic, it doesn't really contract well to push the food down, so
Okay.
you tend to bloat more easily.
I see?
Yeah, it's more of a
Okay.
stomach issue rather than colon.
If I can be open, I mean, I've had two children, right? And I have had issues with hemorrhoids as well.
Yes.
I mean, it came to the point where I couldn't walk.
Yes, it
Okay.
can be
I
very
had to,
uncomfortable.
I had to
Yes.
hobble myself to the doctors,
Yes.
and literally could not function.
Yes.
But
It's so
doctor told me
uncomfortable.
liquid diet. Is that what you would recommend? Because everything, like my soups, my everything, I could not eat any solids for a good maybe 3 weeks.
Were you pregnant during the
No,
time?
it was
No.
post many, many, many years.
Many years ago.
Many
is
years
it?
after pregnancy.
Ah, okay.
Yeah, many years.
I would say that probably your doctor was thinking that you need soft, mushy stools and minimal pushing effort.
Yeah, it
minimal
was the
straining
minimal
effort.
straining because it
Yes.
was so uncomfortable.
That's
Yeah.
right. So, if the hemorrhoids are acutely swollen, they will take time to subside.
Mm.
They don't subside overnight. So, lying down on your side, whether it's left side or right side, helps to offload the pressure around the
pressure on the-
hemorrhoids.
yeah.
Right? You don't sit on your bum. That's
Yeah.
right. You don't let gravity do its work.
No,
so you need to
no,
lie
yeah.
down. And when you lie down to help to get the the swelling down, you're not really moving around. You do not want to take a lot of processed food or a lot of fried food.
That needs
and
to be
slows-
digested,
That's
right?
right.
Yeah.
Yes. So to keeping on a liquid diet does helps to move the liquid stools through, and then you don't really feel the urge to
push.
Yes, to push
Yeah.
that hard. That's right.
Yeah, so it is.
Yeah.
It is a good piece of advice for people who may be having difficulty.
Well, I won't say having difficulty, but having acutely swollen hemorrhoids.
Okay.
Yes. So if the hemorrhoids are in the beginning stage, when they popped out and they kind of block the entrance, it's so uncomfortable, they haven't really subside, because some hemorrhoids do subside and go back in.
Oh, wow.
After the swelling has subsided, it goes back into the inner canal. So if it's the beginning stage, those are the measures that we can do. So we lie down on the side, we put a cold or hot compress, anything that makes it feel better around the anus area, and we apply ointments. So there are painkiller ointments.
Your preparation H and stuff like that.
So
Yeah.
witch hazel, protocidal ointments. Calm it down. So you imagine it's very angry. It's angry and burning below. So you just want to calm it down and say, sorry.
Yeah, sorry.
Yeah,
Give it a
sorry."
little pat,
That's
yeah.
right.
please take care of your arms?
That's right.
Okay.
Cheyenne is like can't stop laughing.
Like it's true, what we
Like
say,
a little pet.
after you do a business, make sure you clean yourself
Yes, for
properly.
sure.
Yes,
Okay.
yes.
That's very important.
So I wanted to ask, we're talking about prevention, which is better than cure. And I guess we never know. Is it something that we should go get checked often, or is it like a lifestyle thing that if we hold true to that, then we should be good? Or, are there things that help prevent
Yes.
either of those things from happening, like the hemorrhoids or the piles?
Oh, yes. Like I say, anything that increases straining effort around the anus area will cause hemorrhoids vessels to swell up. But sometimes things are beyond your control. For example, pregnancy. So pregnancy predisposed to hemorrhoids. Or if, let's say, you have a period of work from home, or when you're very stressed out, you need to sit down and do prolonged work on the computer, that predisposed to hemorrhoids because you're sitting for a prolonged period, you're not really moving around, you're sedentary. So if there's any discomfort below that lasts you for more than, for example, 4 to 5 days, despite conservative measures, always seek medical attention.
Okay.
Right. So the things that prevent hemorrhoids, move around. Move around.
Okay.
Don't sit on the bum for too long. So probably if you sit for a bum for like say 1 to 2 hours, you tell yourself, I need a toilet break. I'm going to drink some water. So what Angel's doing is good. She's hydrating herself, drinking water throughout the day.
And making movements, just making sure
Exactly.
you're moving.
Exercising.
Exactly.
Yeah.
And peeing
Toilet
throughout the
break.
day as well.
That's right.
Drinking so much water.
That's okay.
FD's got a question?
FD.
I do. We talk about moving. We talk about walking.
Yes.
What about exercise?
Okay, doctor, you
Yes.
answer this question when we go on air, okay?
Okay.
For the last time. Okay, here we go.
I let all that get to my head. I don't care, I paint the town red. She a bad little, she a rebel. She put her foot to the pedal. It'll take a whole lot for me to settle. She a bad little, she a rebel. She put her foot to the pedal. It'll take a whole lot for me to settle.
Kiss 92 traffic.
It's heavy traffic all over the place. It is peak hour. After all, if you spot anything, it's 88550920.
We're back with Dr. Cheryl Lau, General and Colorectal Surgeon from Parkway East Hospital. Once again, welcome. Always a pleasure to have you on the show, Dr. Lau.
Yes.
So, Doctor, we've talked about moving. We've talked about walking when you have, or if you want to help prevent piles and hemorrhoids and things like this. But what about exercise when we already have it? I'm talking about going to a gym.
Yeah, like weightlifting and all
Yeah.
That kind of
When you're in
Yes.
pain down there, you will still go to the gym.
Some of them are not painful though.
Yeah, that's true, yeah.
Okay, so what's the question?
Well, it depends
Should
on
we
what
be
we
doing
do
it?
in the gym.
Yeah.
It depends on what we do in the gym. If you're doing just aerobic exercises like on the ellipticals, by all means go ahead because it's moving your gut along. Yeah, it's improving your gut movement. But if you're talking about things like weightlifting, especially dead squats, that's not good. And why? Because when you're squatting down and you're raising a heavy weight, you're using a lot of, you're increasing your intra-abdominal pressure, and that's transmitted down to the anal canal. Your anal vessels will swell up.
Oh
Even
dear.
Right,
more.
right.
If they're already swollen, it will swell out even more.
Exactly.
Okay, okay.
So during the acute episode, please don't do any heavy lifting.
Yeah.
But by all means, go ahead with aerobic exercises.
Okay.
Yes.
Okay.
I just want to ask if I could about pregnant women.
Yes.
Because you said pregnant women and hemorrhoids go hand in hand. Almost all.
Almost,
All.
yes.
Is there any way, if a pregnant woman is listening right now, to prevent that? Because it could be something that lives with you for life
Correct.
after the baby's born. So is there anything that they can do while they're pregnant to prevent hemorrhoids?
Anything that minimize constipation do help.
Okay.
Yes. So
diet,
that's
exercise.
right. I won't say exercise. It's hard to exercise when you're pregnant, but you go for walks. Just go for walks. Keep hydrating ourselves because a lot of times when we are pregnant, we don't really drink enough. Yes.
Okay.
So hydrating means water, not caffeinated drinks.
Okay,
or
not
diuretics.
sodas,
That's
right,
right.
okay,
Yes.
yeah.
Yes.
Okay.
So how do we know we are taking enough? Every time we go to the toilet, some of us have the not so good habit of not wanting to look in the toilet bowl.
The color of
That's
your
right.
pee,
Yeah,
right?
exactly. Just make sure that the color of the pee is clear, light yellow. That's how you know that you're well hydrated.
Okay.
That's right.
In the morning when I wake up,
Yes.
usually my pee is definitely not clear. But that's because it's been like 8 or 6 hours or for long that I've been asleep.
That's natural.
Okay,
That's
okay.
natural. Don't worry. Yeah.
Okay. I've always wanted to ask, and I just had to do it on national radio, I guess.
Yes. Yes.
This is her last week on the show, so that's why.
My
you
last
know.
2 days, today and tomorrow.
We're gonna miss you.
In the morning.
In the morning.
Yeah. I'll
She's
miss-
out. She
I'll
said
miss-
something wrong, so she's out. Joking.
Cry. Anyone listening? I never do anything
No,
wrong.
no, of course not. She's perfect. Thank you.
Extreme at you, Glenn.
It's true. Thank you very much, Dr. Lau, for joining us today, okay?
Thank you so much, Glenn.
Always
you,
a
Doctor.
pleasure.
Thank
We'll
you.
all go and see you if we have any backside issues.
Backside.
No, I do actually want to talk to you
see me,
about that keyhole thing that you suggested.
You should.
yeah.
Yeah,
you
you
should.
absolutely
Yes.
should.
All right, once again, we've been speaking to Dr. Cheryl Lau, General and Colorectal Surgeon from Parkway East Hospital. Thank you, Doctor.
Thank you.
Thank you for tuning in to the Big Show's Good Morning Doctor, brought to you by Parkway East Hospital.
Let's take a photo.
You will
Doctor.
take a photo, but in
yes.
the meantime, we're not done with the Big Show TV. No, you all can
We'll
go
be
get
back.
ready.
Yeah,
We'll be
yeah.
back because Mr Gasper Tan, the CEO of Samaritans of Singapore, is going to be joining us. So don't go anywhere. We're just going to take a photo now.
We're still here. Yeah, you think that's possible? The keyhole surgery to take out the scar tissue?
Yes, but it should be electrically used for things that are swollen.
Oh yeah, I mean right now everything seems okay. Yeah.
I didn't know you guys were doing hard.
Always.
Thanks so much for having me.
Thank you, Doctor. Thank
I will definitely try to make an appointment. Yeah, and then just to ask you what your recommendation.
No problem.
Yeah. Nice to meet
Nice to meet you.
Yeah, because it's been 11 years, you know. I go to the hospital every year.
You shouldn't suffer in silence.
So when the doctor says cannot, you always should go for
Always second or third
No,
opinion.
no, I've had 5
Thank you,
opinions.
doctor. Thank you so much.
And they
Thank you.
all,
Thank you.
I mean, the ones that said I can do anything about it, they were like, or just say that, oh, it's bad.
Okay, so we've had our fiery backside discussion.
Backside discussion.
I said our fiery backside discussion. Yes. No, but it's amazing, isn't it? What you don't know.
Yeah, she's good.
It's really what you don't
I
know.
feel like she's got really great bedside manners.
Yeah, she
Which is hard
She
to
does.
She
find.
brought I saw you.
She brought an ass. Did she bring an ass?
We are still live on Facebook, by the way.
She brought.
Did she
She
brought one.
I saw the.
She should have showed us the backside then.
Yeah.
Did she really bring a model
Because
in?
last year we did ask her to show
Show
us
us,
certain things
yeah.
on
we
the Big
didn't. We
Show
didn't
TV.
see it. We didn't see it.
But I think because the discussion was good, she didn't feel the need to take out.
Yeah.
We love Dr. Cheryl Lau.
Yeah, she's really cool. Very, very cool.
Okay, where's
Okay,
Gasper?
Gasper. We're gonna
Gasper,
welcome.
Gasper. About to come in.
There
Gasper!
he
Gasper!
is.
Gasper! Gasper!
Welcome to the big show. Hi, Daphne. Nice to meet you.
Good to see you again. Come.
Gasper, come. Have a seat. We are live already on Facebook,
We
okay?
forgot
So
our
you can.
pom-poms. Good to have you on. Thanks so much for coming in. Yeah, just put the headphones. Yes.
Yes.
please.
Yeah.
Do you think we forgot about you or what? No, of course we
Is
wouldn't.
it loud enough?
Can you hear yourself? Bring the microphone closer to you.
And then adjust the volume of your headphones
If
there,
you want
the knob.
to.
Yeah. You adjust it accordingly.
Don't be afraid to
Just go
speak
check,
loudly.
check. Hello,
That's you on the screen.
Testing 1, 2, 3.
Yeah, and that's you on the screen in the bottom
Oh,
right.
okay.
Do you see yourself?
Yep.
Okay, perfect.
Okay, brilliant.
SOS.
Brilliant.
Okay, 30 seconds. We're going to go on air and
Yeah.
then we'll introduce you.
We are still not on air.
We are
We're
We are
live on
Facebook.
social media.
Live on
Facebook.
YouTube, Facebook,
All right.
live all the way through
Okay.
till we say goodbye.
Straits Times TV.
Everything.
Everything.
I just heard about that this morning.
Oh, what the live
I
element
thought there
on
was
Facebook?
a break in between.
Oh, no.
No break.
Okay, stand by. Here we go. Shakira, featuring Wyclef Jean. Hips Don't Lie, right here on Kiss 92. All the great songs in one place. Our second guest for this morning is from the Samaritans of Singapore. He is Mr Gasper Tan, who is the CEO of Samaritans of Singapore. Good morning, Gasper.
Good morning. Good morning.
Thanks so much for joining us, Gasper. I mean, we met you at Dr. Jerry's, the therapy room 10-year anniversary a couple of weeks ago. And we just had to have you on the show because during that time that we were having dinner with you, we had such a great conversation about what SOS actually does
Yes.
for the community.
And Jerry was here yesterday, right?
Yes,
Jerry
she
is,
was.
she was. She's
She
here every
was.
Tuesday,
Yeah. So the first question that we want to ask you is, are you the only Gasper in Singapore?
I have never met another Gasper,
Okay.
so
Yeah, I think so.
Yeah, there you go.
Fantastic.
You know, when we think of Samaritans of Singapore, when we think of SOS, we think it's a line to call.
The app. Wait, he said. Are you talking about the ABBA song or?
No.
Let,
Samaritans of Singapore.
let him finish
Right,
his
right.
It's a line to call, and I'm going to be blunt. It's a line to call if I think I want to take my life. But there's more to SOS than just that.
Tell us what you do.
Yeah. So, a lot of people may think that we are a call center, right?
Yeah.
Telephone operator, pick up call, answer call, and hang up the call, right? No. So actually, we do more than that, right? SOS is a non-profit organization to provide emotional support to individuals facing crisis, especially those with suicidal thoughts, right? And we started since 1969, right? We are the first one, I think, in Singapore to have 24 hours hotline. And we still continue to do that today. But it has grown. It has grown. We have altogether now almost 20 programs and services. And 3 years ago, we launched text messaging services. We call it Care Text. And this is heavily subscribed or heavily utilized by youth aged 29 and below now.
29 and below.
Wow.
Yeah.
Wow.
And all our services are provided free to those in need.
Right.
And your services are not just about intervention, but post-intervention as well.
Yeah, so we started from prevention. So we do have training, education, community outreach to basically equip individuals and also professionals how to handle a crisis situation, especially when individuals are at risk of ending their life or at their struggle with mental health. We also do intervention. All right, for example, intervention work, we do suicide attempter support group, which we launched last year, the first in Singapore. Took us a few years to decide how to go about doing that, but we successfully launched it last year, and we have just completed our third run. And it was,
Wonderful.
Wonderful.
And that blew our minds. I mean, when we spoke to you about that,
Yeah.
and you told us about intervention now that you
Yeah.
guys
Yeah.
do. Wow, that is great.
Yeah, and on top of that, we also do specialist counseling to those, high-risk individual with suicidal thoughts or who have the intention to end their lives.
Yeah, that's so important.
Yeah. Speaking of which, I mean, if you need the number is 1767. The line is open 24 hours, right?
Yeah,
Yeah, and they
365
have
days.
Who runs these lines?
Okay, so we, the heartbeat of SOS is volunteer, right? So we do train and equip volunteers to manage our hotline and our care text, right? Care text is also 24 hours. But they are supported by our professional staff, who are trained also, to do intervention work and also to support volunteers in case of extreme cases, right? Yeah.
So intervention and postvention.
Yeah, and postvention is, services that we offer to survivors of those who lost their loved one to suicide. Yeah, so we call them survivors, right? We do have structured and support group kind of programs to journey with them through their grieving journey. Yeah.
Okay, go ahead, Dave.
I was going to ask, because it is quite a difficult position to be in, especially when you're trying to guide youths, helping them navigate through whatever it is they're going through. What kind of training? Is it like very intensive training that people that volunteer at SOS go through or the staff go through? Does it take months or years? And if it affects them, do they take time off? Because it can't be easy to talk to some of these people that they can't prevent, or they can't save.
Yes, definitely. Good question. So I mentioned before, right? Volunteer is the heartbeat of SOS, and that's important because we want to make sure that our services are available free to anyone with need. The other objective of us getting volunteer is also to train as many people as possible with the life skill, right? So that beyond serving in SOS, when they go back to their own life circle, their family, their friends, they can also provide that kind of support, right?
Yeah.
So we hope to do that. So it's a multiple objective that we're trying to achieve. And to your question about volunteer training selections and training, right? We do have a lot of volunteers now with us, about 400 over volunteers. Wow. And many of them stay with us for very long time. The longest that we have so far is 48 years.
Oh, my goodness, wow.
Almost as old as the association itself.
Yeah.
Because you guys are turning 55.
55
Yes.
next year. So if you want to get involved and volunteer or even donate, you can go to sos.org.sg.
Okay, let's continue talking to Gasper on The Big Show TV. It is 8:41.
Go big or
So Gasper, I was gonna ask you earlier. You said a lot of the phone calls that you guys get or the text messages that you guys get are under 29.
Yep.
What are the numbers like? Off the top of your head, unofficial.
So for example, like our tax services, right? Our care tax, 82% of the clients are age 29 and below, and so we do have about. Last year, we have about 9,000 over unique clients texting us.
Are there reasons, like, given, because you guys communicate with them?
Yep.
Is it because of school? Is it because of money? Is it because of a heartbreak? I mean, what are the numbers there? Can you share?
I think mental health is a complex issue, right? And just like physical health, there are so many parts of our body, many issues. Similarly, in mental health, we do face multiple factors as well. I think the most common among the factors that we receive are relationship issues, whether it's a boy-girl relationship or family relationship, father, mothers, divorce,
right?
Yeah, or even intergenerational issues, right? So it's a big part of it is relationship. The second part is, of course, for senior, you do observe medical issues and loneliness. And of course, those slightly younger, you do see, or we do observe a lot of financial debts and issues that they are facing. Yeah.
Wow.
Financial debts. Wow.
I think these are people who feel depressed, extremely depressed to a point. I think, which is why your intervention is so good, because you can distinguish someone who is really on the brink, of ending it all, as opposed to someone who maybe just needs someone to talk to. You know what I mean? So that intervention is so very, very important, because not everyone is equal.
Yeah,
at
for
that
sure.
point
Yeah,
when they
yeah.
call through, so which makes the task of SOS even more difficult. Just back to the whole volunteerism thing earlier on that Daphne was asking you about. I'm sure there is a very stringent selective criteria as well, because you don't want someone, like you mentioned, earlier on, you said, what if they get affected by it? I'm sure everyone gets affected by it.
Yeah,
but
for sure.
at the same time, you need someone who has a certain strength in them to be able to handle cases and talk to them without getting too affected themselves, because you need someone who's cool and composed.
Correct.
So what kind of selection or selective criteria do you guys have when it comes to wanting to be a volunteer, for anyone who's listening in right now who wants to volunteer?
Yeah, so we don't judge people. So we open selection to the public. So we do 4 recruitment drive every year. We put all of them through interview and also assessment workshop, right? Just to have a feel of whether these people are ready, right? Like
Yeah.
you said, right? We don't want to put people on the spot, or put our client or they themselves at risk, right? When they handle this. And after that process of a selection, if they go through that initial selection of interview and also assessment, we will put them on to 6 to 9 months of intensive training. And this training, you do a lot of role play, a lot of practices and supervision, right? And we do have assessment, various assessment at various stages.
Right.
And if they do pass and do qualify, and completed the course, then only we will allow them to be on the front line, right? Taking phone calls or answering texts. But they are always supported by our crisis support team.
Wonderful. Okay.
So you mentioned texts and phone calls. Are there any instances when there are physical interactions with anybody who comes to SOS for help? Or is it all through phone calls and texts? Can they walk in anywhere to get help?
Yes. So at this point in time, we are just doing intervention over the phone and text.
Okay.
But maybe we can share with this next year you again.
Okay. All right. We got plans for the anniversary. Okay.
Which is great.
Yes,
I'm looking at SOS and I think expanding.
Yeah, to be able, a lot of people do
It's the
want
way
to
to go.
walk in as well, and a lot of people need that human contact
They
as well.
do.
So I was just wondering about that. Yeah.
So, if someone wants to help, but they feel they don't have what it takes to be a volunteer, how else can Singapore help you?
Yeah, so there are a couple of things that we can do here, right? So those people who did not completed the training.
Okay, Gasper, I tell you what, hold on.
Okay.
Let's answer this question on air.
Okay.
Cool.
For our last talk set. Hold on. Here we go. Katy Perry with Roar right here on Kiss 92, all the great songs in one place. Our second guest for this morning is the CEO of Samaritans of Singapore, Mr. Gasper Tan. So good to have you on the show, Gasper.
Thank you.
So we were talking about volunteering, Gasper, but what happens if someone feels they don't have it in them to volunteer or they can't commit the time to volunteer, but they want to do something? What else can Singaporeans do to help?
Well, first of all, I think what you guys are doing, amazing work, right? You talk about it, right? Every day, every morning, you invite people to talk about and normalize about health issue, right? Not just physical health, but also mental health, right? And I think this is what Singaporean can do, right? Mental health is a taboo topic, right? Especially on the topic of suicide, right? People usually avoid talking about it. But we do need to destigmatize it, we should create awareness, we should educate, we should also encourage, more importantly, people to seek help, right? And if you have mental struggle, if you have ideation, talk to someone. Call us at 1767 or even text us at 91511767. Help is important, right? At early stage, if you can intervene early, you can, we should be able to, bring the person back to normal, right? The second thing that we can do is, of course, to support our cause, right? Like I said before, suicide is a taboo topic. A lot of people try to avoid us or support our cause, but please do, join us as a volunteer. We have many other services that require volunteer beside our hotline or tech services. We also have skill-based volunteer that we required. We also have ad hoc volunteers for projects and things like that. So sign up, talk to us about volunteerism. The other thing is also to support our cause through our fundraising project. We have been providing free services to those in need, and we intend to keep that for the longest time, right? And of course, we do need some funding to support that. And if you see we do have any fundraising event, please do support us.
Yeah.
Okay.
Is there any way people can actually donate anytime?
Yeah.
now?
Yeah, they can actually go to the website.
Yeah, to the website, yes.
So
Okay.
sos.org.sg. There is a Be a Donor tab. There is a Be a Volunteer tab. There's a Contact Us tab. And under the Contact Us tab, you'll get the hotline 1767. You'll get the care text as well as the care mail where people can drop emails as well.
It's a very nice website.
It is. It is very beautifully done. It's very easy to navigate, so people going in won't have too much trouble to find anything.
Yeah. Let's help you guys out. Anytime you guys need help, Gasper, just give us a call.
Yeah, let us know if you have an event coming up, if you need fundraising, let us know. Do you have anything coming up? Right now?
Actually, this Saturday, we do have, we call it the ISOS Lost Day, right? International Survival of Suicide Day. It's a closed-door event. So I'm appealing to those, who may have lost someone through suicide. Reach out to us. Please, we welcome you to that event. It's a closed-door event that we want to reach out to you to support you throughout your journey of grieving. Yeah.
Wow. Okay.
Okay, and how can they...
they can,
website.
Yeah, the website.
as well,
There's
okay.
an email, pat@sos.org.sg.
All right.
Okay.
So if you really need help, there you go. You're listening to us right now. This is the answer.
Yeah.
Thank you very much, Gasper, for joining us today. We've been speaking to Mr. Gasper Tan, CEO of the Samaritans of Singapore.
Thank you, Kiss 92.
The Big Show.